I am live. Hey, everybody, this is Aaliyah Sherrod, the healthcare queen. I just wanted to come on live today. Today has been a very interesting day, and it's been very interesting. So I just wanted to come on. I haven't been on for a while and just talk about some things that I go throughout the day in my journey of helping people with their health care. Some of you maybe don't even realize it, but there's a lot of different parts to health insurance. I don't want to be boring. I don't want to be, but this is something that I have a passion for. A lot of people don't want to talk about it. I am trying to unravel the puzzle because it is a puzzle. A lot of people have serious problems picking a healthcare plan if they have one. And that's my job. My goal is to make sure that all of us have adequate health insurance. With the passage of Obamacare years ago, a few years ago, healthcare became accessible to most people. And one of the things that it did is it created a way for people to have health insurance that have pre-existing conditions, things like that. So I'm going to tell you a story. Back in, I think it was 2007, my husband was really sick. And this is one of the reasons why I'm so passionate about this. He was really sick. And I had a job, so I had health insurance on my job, but it was fairly expensive. And so when Obamacare came out, and later, we were able to get an insurance policy that had a super low deductible. This is something that had not been heard of in a long time. Healthcare has changed, the deductibles have changed. We were able to get a really good policy. He was able to get the care that he needed. Because we had a really good policy that we could pay on our own that was affordable for us. And when I started my self-employment journey, I had to find health insurance for us. And so those are one of the things and one of the reasons why health insurance became my passion, because finding a plan that was affordable, something that would cover the situation that we were in, and the illness that it had to cover, it was really important to us. And so what I do every day from my desk, and I work from home, is I make sure I educate people. Education is so important. I educate people on how to pick a plan and what to look for in a health insurance plan. I explain to them what an HMO is. Excuse me, what a PPO is. A lot of people don't know. So what I'm going to do is on Friday nights, after everybody winds down and it's quiet, like right now, it's really quiet, and people are probably just relaxing. I want to come on and talk about things that happen to real people that I know, friends of mine, things that if they had done things differently, maybe the outcomes would have been differently. I don't know, but I want to encourage everyone. If you just like this video, share this video, go to my page and make a comment. And we need to talk about this. We have a lot of noise out there about insurance and how bad it is, or what it doesn't do, and how expensive it is. Well, I want you to try not having it. That is what we're trying to avoid. It breaks my heart when I talk to clients every day. They were healthy one day, and then the next day they go to the hospital. I don't know why something's in my throat. They go to the hospital, it changes their life. I apologize for that. Something's in my throat. And it changes their life. And you want to make sure that you're covered. I had a client today, and she was literally in tears. And it touched me. That's why I said, I need to do this every week. If I could help one person, reach one person, help them to get a health insurance plan, and works for them, then I've done my job. I've done everything I needed to do. But today, on January 1st, her whole life changed. Her husband had to go into the hospital, and they didn't have adequate insurance, and they got a bill, and that bill is over $70,000. And she asked me, she said, "What can you do to help me get this paid?" So I'm going to try to help her. We'll figure out something. But I had been on her that month to pick a plan, decide, and they didn't do it. So that's just part of the bill. That's not all the bill. That's just the first part of it. So there are things that happen in my day-to-day business while working with customers that I see that I really need to start talking about this, because we have access to health insurance. Some of us might think it's not affordable, but I'm going to show you what you need to look for. And if you can't afford something that's low deductible, then how to make sure that you are covered 95% for accidents, for critical illnesses, for cancer, for home care when you get home. How many of you know someone, and I do, that had broke their ankle? 6 to 8 weeks, couldn't hardly walk. What would you have done to have somebody help that person full time? Just think about it. If you had somebody that could come in and help you full time, instead of maybe begging a family member or something like that, and getting angry, because it takes time. And helping someone, it can be challenging. How many of us are taking care of our parents, our aging parents? And we don't think about it. We just do it. My sister just does it. You know, I have my mom, she's aging, and my sister just does it. And, there are ways and things that we have at our disposal as insurance agent that we've taken advantage of. And so the burden is not too bad. But how many of you out there have thought about, what if something happens to you? How many of you are out there taking care of your loved ones? So these are some things that I'm going to be talking about every week. I want to bring this to the attention of people because it needs to be talked about. We love our family. We don't want anything to happen to them. But when it does, we want to make sure that we're ready for it. We're ready for it. So I want to give everybody encouragement. And I want to be able to come on here and give you real life examples. Won't say any names, but real life examples of things and situations that happen that have worked out for the good and for the better of people. So with that said, it's getting late. I just wanted to come on for a few minutes, start my weekly broadcast, because I just said I had to do it. Just do it. And I think I'm really glad that I did. And I want to make sure everyone understands that that's what I do. If you know someone who needs health insurance, you know someone that is struggling to pay their bills, and this is all healthcare related. I'm a life insurance agent. I do life insurance. I do all that. But what I've done is I've realized that my passion is actually helping people with their health care and making sure that they're covered. Then we can worry about the other stuff. And so that's what I wanted to say today. I want to say hello to everybody. I can't see any comments. I can't see anything. I think I'm live. I'm hoping I'm live. If I'm not, I've been talking to myself, which is okay. So my name is Aaliyah Sherrod. I am in beautiful Buckeye, Arizona. I love it here. And I'm going to say good night. I am the healthcare queen. Make sure you reach out to me on Facebook. Instagram. I'm starting my YouTube channel. We'll figure it out in a little bit. I'll figure out how to get that done. But I wanted to say hello and good night, everybody.